And joining us now here in the studio to talk about the world's largest student competition for social good, 4 students from the University of Toronto. Carrie Patterson and Neil Pete, Matt Cahill and Deborah Krieger. And it's good to have you all here at TVO in our studio. Okay, Matt, why don't you start us off, because you 4, plus one other who is not with us today, are all in pursuit of something called the Hult, H-U-L-T, Prize. What is that?
So the Hult Prize is a social entrepreneurship competition organized by the Hult Business School, and it's in collaboration with the Clinton Global Initiative, at least for the last 2 years. The idea is that they identify a pressing social problem, and they set it as a competition for business students, well, all sorts of students all over the world. And the idea is that by making it into a competition, you can access thousands and thousands of eager young minds and pick from among them the best solutions. So it's a Darwinian approach to problem solving.
Carrie, what is the social problem they have identified this year that you're working on?
So this year they've identified non-communicable diseases as the point of entry, and with a particular focus on addressing the issue in urban slums. And so that can sort of take place anywhere in the world. We've, as a team, discussed sort of slums from Brazil to Kenya to Haiti. But the idea is looking at places rather than sort of more rural healthcare, which is typically what we talk about when we talk about global health, really honing in on what we do in sort of urban slums and city centers.
And Neil, non-communicable diseases means what?
That's right. Well, it means things that are not transmitted through viruses and bacteria, et cetera. It's things that often are genetic or can be environmental. So for example, I'm a diabetic, which means I have a non-communicable disease. So that would be one of the areas that is targeted. Other ones that are very significant in the world right now: cancer, cardiovascular disease, diabetes, of course. Certain other ones which fit into that category might be things like mental illness, or even injury could be considered a non-communicable disease.
Okay, so Deborah, unlike, say, malaria or ringworm or these other terrible third world problems, you're not about finding a solution to that, right? This is different.
This is different, yeah.
Okay.
And I guess one of the things that makes it so different and that makes it so complex and kind of a fun thing to unravel for us is that non-communicable diseases also have a large social or cultural component to them. So there's all these factors that are influencing what people do and how people go about their daily lives that makes non-communicable diseases really tricky to identify particular things about them.
Matt, yours is one team out of how many in this competition?
I can't say for certain how many teams were selected, but there were thousands of applications to get to the regional finals, and we can expect dozens, if not 100 teams in each regional final.
And where are you at right now?
So we're preparing for our regional final.
Yeah, I mean, to jump in a little bit, I think the estimates that they last put out were about 4,000 teams that applied, and I think it's about 30 teams per region, so they're down to 200 out of 4,000 teams.
And what region are you in?
We're going to Dubai.
You're going to Dubai?
Yeah.
You're going to Dubai?
To compete, yes.
To compete. And do you know how many teams you're going to be competing against in Dubai?
It's between 20 and 30,
yeah,
but it's about
20 to 30.
Yeah.
All bright young university-based students like yourselves?
From around the globe.
From around the world?
Yeah.
Who are all in pursuit of a solution to this issue around non-communicable diseases?
Yeah, absolutely. So teams of 4 or 5 from universities anywhere. You pick which region you wanted to apply to. So there were regional finals in Dubai, Shanghai, London, San Francisco, Boston, and Sao Paulo. And then essentially they picked from the best applicants to each one. And so there's, I think, just under 200 teams making it to regional finals. And you essentially have to win at your region. And the finalists from each one will then go forward to the next round of the competition, or the final round.
Why are you competing in Dubai?
So it's an interesting question. Part of it is that the University of Toronto actually is selecting where they're sending different teams, because you can only have, in general, you only have one team per university going to each region. So University of Toronto has a large number of students, and this year I think they're sending 4 teams. So we selected a region that actually gave us an opportunity to not compete against other U of T teams.
So the other U of T teams are not going to Dubai, they're going to other places.
There's one going to Shanghai, one going to San Francisco, and one going to Boston.
Let me ask the obvious question here, Deborah, which is, getting to Dubai, I presume, is expensive.
It sure is, as it turns out.
So how are you getting there?
right now, I think actually maybe I'll pass it on to Carrie to talk about our
Yeah, I
fundraising
mean, like
online.
we tossed around the idea of hitchhiking and decided that probably wasn't the best plan. And so we've sort of engaged in a bit of fundraising, and we're hoping, we've been meeting with different parts of the university, from the business school to the Monk School, and the Department of Exercise Science, and sort of all over the place, trying to see where we can gather funds. But we've also launched an online fundraising campaign that we've been spreading to friends and family and on Facebook and sort of all over the place, hoping
So the
to get
university
some
is not
support.
paying for you to get there?
They're giving us money to support us, but they're not paying in full. And unfortunately, this round of the competition doesn't come with funding from Hult, and so it's sort of on us to fundraise our way to Dubai.
So you not only have to find a solution to diabetes around the world, but you have to figure out a way to raise money to get there. Is that right?
Yes.
No sweat, right? Not a problem.
All in a day's work.
All in a day's work. But I mean, this is a bit of an issue, is it not? I mean, is it a done deal that you're going to have the money raised to get over there?
I think at this stage we're close enough that we would be willing to take the costs on ourselves. Both the Monk School and the Business School, and I mean, as we mentioned earlier, we're affiliated with quite a few departments at the University of Toronto, so we go cap in hand to each of them, and they pitch in, and we're close enough now that I think it's a done deal.
Let's go around the table here and just talk about those affiliations for a second. You started at University College, U of T?
Yeah, so I did my undergrad at U of T. I was a University College student in Peace and Conflict Studies, focusing on access to and delivery of healthcare in war zones, and now I'm doing a Master's of Global Affairs at the Monk School.
At the Monk School,
Yeah.
okay.
I started at Western, at the Richard Ivey School of Business, and have basically done business ever since. And more focusing on the social entrepreneurship side, I'm now doing a combined degree at the Monk School with Carrie, but also at the Rotman MBA School.
Okay. Deborah, how about you?
Well, I started at Western as well, not in the Ivy School of Business, but in Health Sciences. And
That was your undergrad?
That was my undergrad, yeah.
Okay.
From there, I took a few years off to find myself, and I found myself in public health. So I did a Master of Public Health at Queen's. And now here I am at U of T studying in sociocultural exercise sciences.
You're going for your PhD now.
Yep, that's
So, do I call you doctor yet?
not quite yet.
Not yet.
Yeah, no, maybe in 4 or 5 years.
Okay.
Hopefully in 4 or 5 years.
You're on the way. Okay.
Yeah.
Matt?
I did my undergrad at U of T, and I was in the life sciences. I then did my PhD in microbiology at Cambridge. And then I came back to Toronto after working for a few years to go to law school. So I'm a joint student at the Faculty of Law and doing my MBA at Rotman as well.
And you have a PhD?
I do.
So I do have to call you Dr. Cahill.
Well, you don't have to do anything.
Okay. How many degrees amongst the four of you here, either having or working towards?
I think among the four of us, I'm not sure. Among the team of 5, we're 15.
Including the fifth one.
conferred or in progress.
Not bad, guys. Okay. Not bad at all. Bill Clinton picks the winner, right? Is that right?
He's one of the panelists who picks the winner. So there will be a panel of 5 or 6 experts. Mohammed Yunus will be on the panel.
Who's that?
From the
and-
Grameen Bank. I'm not sure if you're familiar with like microfinance, microcredit.
Oh, yes, okay.
So he's Nobel Peace Prize winner
Yeah, Nobel Prize
for
winner.
the Grameen Bank's work. He'll be on the panel as well.
And so it's sort of a number of global experts in this area, and Clinton is among them for sure.
Have you met him before?
I haven't. I don't know if the rest of our
Anybody
team
here met
has.
Well, I saw him once outside a bookstore. But, yeah, he just was coming out from a talk, but it seemed really neat.
And the winning applicants get
$1 million.
$1 million bucks. Towards what?
Ideally, to implement your business plan. No, it is intended to implement your business
We
plan.
really don't want to keep it.
It's not a prize. It's an investment, so that you can take the idea that you've pitched and implement it.
The competition is set up as a venture capital fund. So the finalists from each region all go to New York and they don't necessarily receive a lot of seed money, but they receive what's called the accelerator program, where you get partnered with business people who have expertise in your area, and they help you to implement your idea until the final competition, where you demonstrate, okay, here's our idea, but here's how far we've gone so far. And then the $1 million is an investment to scale up your idea.
Do you have a guess, Matt, as to how many people around the world, sorry, Neil, I'll ask you this, a guess as to how many people around the world suffer from the maladies that you are trying to find solutions to?
So it's millions. 36 million people a year, it's estimated, die from NCDs each year.
Non-communicable diseases.
That's right, from non-communicable diseases. But as Deborah mentioned, the complexities of identifying, necessarily cancer, diabetes, obesity relating to cardiovascular disease, maybe smoking related to lung issues, it's quite complex to put a number on it, but you can assume that if 36 million people per year are dying, there's hundreds of millions of people who are suffering, and the burden is especially heavy in sort of the developing world, where those issues are even more complex.
One thing that's worth noting is that in the developed world, there isn't the same record keeping or data collection as you might have in North America or Europe. And so any estimates as to the extent of the problem are going to be unreliable. Or perhaps estimates at best.
And what they've done for the Hult is the specific challenge is that in 5 years, your idea needs to be able to reach 25 million people.
Huh,
so
minimum.
So $1 million, not to be eligible necessarily, but what you're trying to do is to demonstrate that your idea has the ability to, and then the challenge for you once you receive the money is to actually reach that target.
You wanted to say, Deborah?
Oh, no, that's great.
Oh,
That's a
okay.
good way to
I
sum that
thought
up.
I heard you trying to get in there. Let me ask you about this. I don't know if this is proprietary information or whether you can actually tell us what your idea is to solve these problems we're talking about here today. Can you say?
I will give you as diplomatic an answer to that as I can.
Okay.
I guess the first stage of the process when you go through the rounds of application is more identifying how you understand the problem and what you see as sort of the critical issues. And so we as a team talked a lot about issues of access, issues of delivery, whether we wanted to focus on prevention or treatment or sort of triaging. And while we won't tell you exactly what we're doing, I think it's safe to say that we as a group have put a lot of effort into trying to identify how we can best either piggyback on services that are already existing, so places where care is available but just being either not as accessible as it could be or accessible to the wrong parts of the population, and also looking at what prevents people from seeking treatment. And so one of the things that we as a group have talked about a lot is when you look at the burden of non-communicable diseases, of which I think 80% are concentrated in underdeveloped countries or in the developing world, we were looking at places like Haiti or Kibera slums in Nairobi in Kenya and talking about the extent to which people may forego medical care because they can't take a day off of work or they can't sort of deal with the amount of time that they would spend waiting when they could be out working. And so sort of the economic side of this is something that we've chosen to focus a lot on as a team. I don't know if anybody else wants to.
And I mean, so from the business side of things, are you familiar with what social entrepreneurship is?
Give us your handy-dandy definition just to make sure we're all on the same page. Go ahead.
So the idea is that an entrepreneur is somebody who has a business idea and sort of wants to scale it up and take it to the world. Social entrepreneurship just means you're not motivated by the typical business drivers of profit or bottom line. Usually you're targeting something that sort of has to balance profit and social good. So in this case, our thought is an NCD is quite a challenge, but the question is there an economic way to solve that, but also to create a business out of doing that? So typically a business would just say, okay, well, I'll sell you a product and you pay me for that product, we're done. What we've done, as we've said, is we've had to look at this problem in slightly different ways. Everything Carrie said is extremely true and very challenging. So where you start looking is sort of alternative business models. Think, for example, of Avon, right? You now are actually empowering people to sell for you, but they can only do it if you're giving them a product they believe is worth sharing. Or, for example, something like Alcoholics Anonymous. Well, you're challenging people with something that has a fair amount of social stigma, but they're self-identifying because they believe, okay, there's a community that I can be a part of. So when you start blending ideas like that into a typical business model, that's where we're going. Again, we're not going to give you the answer per se, but you can just imagine as you layer those on top of each other, if you're providing a good product at a comparable cost with a community and a distribution model that actually allows you as the person who has the disease to make money while distributing this product. That's pretty compelling, and it gets around a lot of the barriers that you as a large corporation might normally find when you're trying to sort of address these issues.
Gotcha. I did hear you trying to get in that.
Yes, I was going to say an additional challenge I think that that you guys I think both touched on as well is the idea of this, that you need to take a chip off of this very complex iceberg. They need to find this particular business solution that will address so many different things and so many different factors that it's an interesting challenge for all of us, I think.
Matt, I wonder whether international espionage is part of it. I'm only asking this partially facetiously, but you're not giving up a lot of proprietary information here, because I guess you're concerned that if this is out there on the internet, somebody might, who's in competition with you, find out what you're up to and steal your ideas. So my question is, are you out there, is your fifth guy not here today because he's out there spying on all the other teams?
Well, there are a number of ways that I could answer that. The first is that the advantage of this model is that you're getting a whole bunch of ideas, different ideas. And so it's no good if we were to be quite vocal with what we think ought to be done, because it takes away the advantage of having 10,000 different ideas all competing, the fittest one emerging at the end. In addition, it is still early days, and so up until this point, we were selected in large part on the basis of the case we made as a group for being able to come up with a solution. And that's one thing that's been wonderful so far, is that we brought people from much different backgrounds. And so I was a scientist by training, Deborah's exercise physiology, business, international development, and I think that that's the sort of approach you need to come to grips with a complex problem like this. It's also quite rewarding, and I think it's worth noting that although we're all chasing a $1 million prize for the winner, my understanding is that in past, many of the ideas that made it to the finals were implemented anyhow. You get that far and it's a pretty good idea.
Right. So just even if you don't win, you guys may be off to the races on something
yeah,
here.
certainly.
Let's hope.
And McGill won last year, right?
I think that had a big impact in sort of energizing Canadian universities to send in more applicants. But yeah, I would say it's quite a feather in McGill's cap, but this is quite an international competition as well, so it's also something that benefits Canada.
If McGill won, guys, U of T, come on, U of T.
Next, the Habs are going to win. It's going to be.
God, perish the thought. Don't say it, don't say it. Well, it's really good of you to come into TVO today and share some of your ideas anyway going forward, and we wish you lots of luck in Dubai of all places. When's the competition? When do you present?
We're presenting on March 7th and 8th.
March 7 and 8.
Yeah.
And then you cross your fingers. How long before you find out?
I think we should find out that night.
Really?
And
They decide then?
Yeah, right there. So we should know that weekend if we're moving forward to New York or not.
Fantastic.
Or a sad flight home.
Yeah.
Or a sad flight home. Lots of luck to all of you. Carrie Patterson, Neil Pete, Matt Cahill, Deborah Krieger. Good luck, guys.
Thank you so much.
Support Ontario's public television. Donate at tvo.org.